is Larry Dougherty. I started treating patients about 25 years ago, and in that time, we've changed and we've learned a lot. Years ago, I was getting very frustrated with how I was treating and the results that I was getting. I was doing what we were taught in school, what we were all taught, and it just didn't seem to be working for me. I was having lots of problems with patients having decay after all my work, after patching things up, patients breaking and getting frustrated with restorations not lasting. So about 10 years ago, I started looking for answers. I started looking for solutions to the problems I was having. And I found a institute in Seattle called the Coase Center. And I've been working with them for about 8 years and using their principles and techniques to avoid problems. And what they've done for me has been absolutely amazing. It's been fantastic. Our dentistry has gotten much, much more predictable to the point where we go through and do checks and hygiene and patients aren't having problems anymore. And that has to do with motivating patients and getting them to understand where their problems are if they have disease, periodontal disease or decay, and getting to the root of those issues. I mean, I can fix things, but I need patients to work with me and avoid having those problems again and save themselves time and money. And it also got into how patients were chewing and how their teeth were coming together and avoiding functional problems. And what that means is, how do we do things that don't break, and how do we do crowns and fillings that last and are predictable. So we've been doing this for, like I said, about 8 years now, and we've had huge amounts of success, and we're able to design a practice and a method of doing things that give patients the result they want. The most exciting thing we do here is change the way things look, and we like doing cosmetic or aesthetic dentistry that makes patients feel good about themselves. But underlying that, we need to make sure that dentistry lasts, and that's why we go through those techniques that I mentioned before of making sure they function properly and making sure there isn't anything that's going to cause those restorations to fail in the short term, and allow them to have good-looking smiles that they can be proud of.